A big question that people have is what caused my child's cancer?
So we did the CT in Sudbury and there was a solid mass.
As cancer genetic counselors, we are trying to understand why a child has developed cancer.
Sick Kids was very big on let's find the cause. Why is this happening?
My name is Bailey Gallinger.
I'm Rose Venier,
and I'm a genetic counselor in the cancer genetics
program here at Sick Kids. Genetics is such a fast-moving field.
When I first started, we did a lot more targeted testing, and now we can look at all the genes in our body at the same time.
Historically, genetics is kind of the last stop, the thing that puts all the pieces together. But now we are really seeing a benefit to doing genetic testing up front, especially for kids with cancer, where we can understand what's going on in their tumor as soon as they are diagnosed and how that relates to their healthy cells.
Tumors have a lot of different gene mutations that can be helpful to target therapies, for example. And their healthy cells are important to see why they developed that cancer in the first place. A genetic test result can help tell us, was it a sporadic cancer that happened by chance, which is the vast majority of them, or was it caused by a hereditary cancer syndrome, meaning the person was born with a change in their genetics that actually put them at a higher risk to develop that cancer. This is the genetic counseling pipeline. So we start with getting the referral.
We get referrals from a number of different specialists, including oncologists, endocrinologists.
We review their referral and why they come to us. Then we meet with them either in person or virtually. Hi, thanks for joining me on Zoom. Did your doctor tell you why they were referring you to cancer genetics? Then we start by getting a bit of a medical history. Yes, I'll start with the medical history. I have some of it written down already in Epic, but just to confirm. So we take a very in-depth family history by drawing out what we call a pedigree. We do an on-the-spot analysis to see if there is a strong family history of cancer or not. It can go either way.
So this is a pedigree of a family who has different types of cancers that make us suspicious for a cancer predisposition syndrome called Li-Fraumeni syndrome.
Once we get a better idea of their medical and family history, then we do the genetic counseling appointment.
They taught us, I think, everything that we know.
Giving them information on sporadic versus hereditary cancer. Can you see my screen okay? We often use slides to show the difference. Then we help organize the genetic testing. So we'll organize the testing for Andrew on a blood sample that we've actually already collected. Then we talk about possible results you'd get from the test.
Now we do know that Gino has Dicer 1, that I have Dicer 1. He did have cancer. They were able to treat him, but now we're taking extra measures.
Sometimes even a negative test result is extremely important to a family because we can be more reassuring that we really think this cancer occurred by chance. Okay, I have good news. Sam's test results came back negative for the RB1 gene mutation, most likely the retinoblastoma. The eye tumor was sporadic. So now no one else needs to be tested and we're less concerned about tumors in the second eye or other secondary tumors that we had discussed earlier. And then for the patients that end up getting a diagnosis of a cancer predisposition syndrome, we then send them for surveillance. We want to watch them closely. So we refer them to our cancer genetics program, to our oncologist, endocrinologist. Usually it involves MRIs once a year, imaging, x-rays, for example, blood work.
My mom had cancer after I was born and before as well. So they did a genetic test and she was positive with Li-Fraumeni syndrome. So then she tested me and my sister. I was positive, but my sister was not. So then we started coming here.
So I just wanted to check in with you. I know this is your first derm appointment for your surveillance.
We know that we can't at this point stop a cancer, but we know if we catch it really early through surveillance protocols, there's been a lot of studies that show kids can do much better.
If anything is there, it gets checked really quickly and catched early.
And we also help organize genetic testing for their family members to see if anyone else in the family has the same syndrome that they do.
So they were able to coordinate for me to get my testing once Gino was positive. And then they were also able to do that for my mom too.
As a genetic counselor, one of the things that we think about is how this affects the entire family.
So there's a 50% chance that I pass it on to my next children. So our family planning does become a lot more complex, but the genetic counselors here at Sick Kids were able to guide us on different options.
I feel like I'm in good hands and safe. I feel like I can ask them anything.
Working at Sick Kids is such a special opportunity. We are so lucky that we have all the experts here together. We get to learn from the best. We get to help teach the best. I don't know if we need the other slide about hereditary lymphoma. I think maybe one's enough. Okay, I think we have a good plan. Have you been to the Sears Cancer Clinic yet?
I have not.
So I'll show you how it works.
I get really excited working with families. I also interact a lot with the research team. So they're doing cutting edge stuff, looking at things like mutational signatures, single cell analysis of RNA. Like, because we work so closely with our research and clinical colleagues, we are practicing true translational medicine.
It excites me that I get to be part of such a special team.
You don't feel alone here. There's a great sense of community and understanding that the way we're going to learn more is by working together.